Welcome back. A story you have to see to believe. A Chicago woman gives birth in her car on a highway after being turned away from a local hospital. A nurse telling her they couldn't admit her despite being minutes away from labor. Tia Ewing brings us this story.
Leon and Mercedes Wells says they called the hospital to let them know that they were coming because she was already in active labor. And when they got there, the expectant mother says she was ignored and allegedly booted out of Franciscan Crown Point Hospital. And she has the video to prove it.
My daughter's in active labor, and this is a Franciscan Crown Point being put out in active labor.
This is the video captured as Mercedes Wells was wheeled out of Franciscan Crown Point Hospital in tears and pacing her breathing.
So we got to transfer her to a different hospital while she's in labor, in pain.
The mother of now 2 says she was in full-blown labor.
So we pull off, we got to the end of the parking lot. As soon as we get on the expressway, which was literally right there at the hospital, so it's the hospital, then the expressway. We get on the expressway, 2 minutes in, I'm like, I have to push. The head came out, he's on the phone with 911. My baby's head is out, what do I do? He pulls over to catch the baby, because the second time I pushed, she came out. So that was it, 2 pushes, she was out.
Wells gave birth in the family's pickup truck on the side of the highway. Her husband was forced to deliver their baby himself without medical assistance. In the video, you see little Alina on her mother's chest, weighing 6 pounds. Her umbilical cord still attached. And if you look closely, you can see the pickup truck is moving. In 8 minutes from being discharged, their baby girl was in the world.
They was discharging her. I'm like, so when you think she's gonna have baby? Today, tomorrow? I don't know, maybe today, maybe tomorrow, we don't know, maybe next week. She was real, nonchalant about it. I'm like, so you don't, she's in labor.
The Wells family told me they only saw a nurse.
Our nurse was 25. She had been a nurse for 2 years, she told us. And she had only been in labor and delivery for months.
The family gave birth to their 2.5-year-old daughter at Franciscan Health Crown Point in the past, before the hospital moved to its new location in 2024. This time, Wells says she pleaded with staff not to be discharged, but a nurse told her she had only dilated to 3 centimeters, even after 6 hours of labor. When you requested, well, where's the doctor? I don't agree with you. What happened?
She said doctor already gave orders. She didn't want to talk about this anymore.
I showed Dr. Jamir Abdur Rahman, a certified OBGYN for 25 years, the video to see if he spotted any red flags.
It's not that these people don't provide good care, but I don't think it's the same level of care you would see if a physician evaluated the patients. And so I think you start to see more and more of these things happening as you're not having doctors assess patients. But also I think a lot of these hospital systems, if they're being honest with you, they'll tell you that there's a lot of pressure on providers to keep things moving.
This is where the family is now at Community Hospital in Munster, recovering.
She's doing great. This is her. She's napping.
As for the mom of 2, she says the entire birthing experience was traumatic, something she's still struggling to process and can't talk about without breaking down.
The emotions come in waves. It's like I'm okay at one moment, and the next moment I'm bursting out in tears. Resources. I'm sorry.
Franciscan did release a statement saying this: the health and safety of our patients is always our top priority. We have launched an internal investigation into the alleged incident. Due to patient privacy laws and our own policies pertaining to internal investigations, we are unable to comment further at this time. As for little Alina, she is doing fine. She came into the world at 6:28 Sunday morning. The family says Community Hospital is finally giving them the level of care they deserved from the start. They have now hired attorney Cannon Lambert, saying they don't want what happened to them to happen to someone else. In the studio, Tia Ewing, Fox 32 Chicago.
Now, hours after that story first aired from Tia on Monday, the hospital's president and CEO Raymond Grady issued another statement saying in part, quote, We're aware of the video and the concerns expressed on social media regarding the discharge of a pregnant patient from Franciscan Health Crown Point. The video and the comments it has generated are deeply troubling, and we understand the concern this has raised. The video is just one part of the information we are reviewing as part of a thorough investigation into this alleged incident. He added, the reality is disparities in healthcare outcomes exist, and Franciscan Health Crown Point strives to be part of the solution, not the problem. And to that point, this is not the first time, even in the last several days, that this has happened around the country. And in the African American community, local data shows that there are disparities in birth complications and infant mortality between white and African American women. Now, Cook County Commissioner and congressional candidate Donna Miller has been working on this issue, including launching a free doula program across the country, and she joins us now. Commissioner Donna Miller, thanks for being here. When you watch what happened to that woman, as someone who has been focused on these issues in Cook County, what goes through your mind?
Well, I wanted to cry along with her. It looks very discouraging for the families, for the mother and the baby, but luckily she made it. And unfortunately, the data does show us that many women do not make it out of these situations. These issues of maternal mortality are 91% preventable. If you can see that just from watching what happened to the woman here. They let her go in active labor, and she had to deliver her baby in the truck.
So is this a recurring issue where women, especially African American women, are not being admitted?
They're not being admitted because their concerns are not being addressed properly. Someone told her that, in this instance, they told her that she should just go home. Even having her husband there saying, are you sure? I mean, what are we going to do? We have to address all concerns with the same level of care and concern for whether you're African American or not. But unfortunately, disparities exist, especially for African American women.
Do you believe this is an issue of access to care and potentially, racial bias?
It's not access to care. This is an implicit bias, and we need to make sure that we're assuring that we're training professionals on how to have their concerns met, whether they're African American or not. But when we see the disproportionate amount of African American women treated unjustly, that we can't only say that it's racially motivated, and it's due to implicit bias that is experienced in the healthcare system.
You mentioned it was just days ago this happened in Dallas.
Absolutely, and that woman was in active labor, and then she was being asked questions while she's in active labor that had nothing to do with her being pregnant and about to deliver. Same thing, delivered moments after she was discharged.
Tell us about the doula program, why you launched it and what it does.
Well, so for the last 3 years, I've been very focused on maternal morbidity rates and how we can improve the outcomes for Black women. And we launched the first ever doula program here at Cook County Health and Hospital System. I'm very proud of that. That is to help to eliminate these disparities. Doulas are mid-level providers that can be with you throughout your pregnancy journey at any point. And what it does is going to help someone, advocate for themselves, empower the family to advocate, but mostly it also lets physicians and the healthcare system know that someone else is there that can help address some of these issues. Maybe if she would have had a doula with her at that time, they would have said, no, you do not need to be discharged. 3 centimeters is enough for us to stay here and make sure you have a safe and healthy pregnancy.
And in fact, you have gone through this yourself in one of your experiences.
Yes, well, unfortunately, this was 22 years ago when I had my first child. Well, the person who was delivering for me, or I went in ahead of time, and he's asking me questions like, oh, am I sure I'm not drug seeking? Have I used drugs in the past? These are not the kind of questions you want to ask someone who is in labor and about to deliver their first child.
This is not typical, right, to ask those kinds of questions in the middle of labor?
I mean, I don't know if it's typical, but it was uncalled for, and we did get an apology. But unfortunately, these are the things that happen to many African American women.
All right, Cook County Commissioner Donna Miller, very important work that you're doing. Thanks for joining us.
Thank you for paying attention.
You bet. And thanks to Tia for that story, and glad that it has ended happily. And some final thoughts right after the break.